My favorite thing about working in healthcare is the people. This industry brings together brilliant, highly motivated individuals who are driven by the opportunity to make a difference. My name is Hallie Tecco, and this is The Heart of Healthcare, a podcast where I'll be introducing you to the people on the ground moving the needle in public health and medicine. Teenagers have a bad rap. They are intense, moody, emotionally distant, or are they just misunderstood? Today's guest is an expert in teenagers and teen health and has more empathy for this age group than anyone I've ever met. She is going to tell us about how coming of age today is so different from when we were teens. Dr. Hina Talib is an Associate Professor of Pediatrics and an OBGYN at Albert Einstein College of Medicine in New York City. She is a spokesperson with the American Academy of Pediatrics and serves on the executive board of the North American Society of Pediatric and Adolescent Gynecology. As a teen health advocate, Dr. Talib leads a popular Instagram account at Teen Health Doc, where you will find her most timely tips and stories. Hina, welcome to the show.
Hi, thanks for having me.
So, how is coming of age today so different from when we were teens?
Oh my goodness. Coming of age is such a special time, but the world has changed from when we were teens. Everything is faster now. There's so much more information. There's so much more access to information. Puberty itself feels faster. It is, in fact, younger. And I don't know, I feel teens today carry literally the weight of the world on their shoulders in a way that we didn't as much when we were younger. Everything from all the issues like climate change and income inequality, racial injustice, and on and on. I feel like it's just heavier.
What are some of the health issues that teens face because of all of these things?
Yeah, adolescence, it's such a magical time in development because you're laying the footprints of behavior. And so it's a really wonderful age group to work with. And there are periods of risk when you might take some risks that are developmentally normal to do, of course, but they can get you in trouble. So things like substance use or smoking, if they're started in these young adolescent, these critical years, they can be lifelong, unfortunately. Things like that reproductive health concerns like sexually transmitted infections. Actually, teens carry a greater burden of disease when it comes to STIs than other age ranges. Everything from unintended pregnancies and of course, mental health.
Yeah. So we love to hate teens. I feel like they have such a bad rap.
My gosh, yes.
Why do you have so much sympathy for them? And what inspired you to work with this age group that the rest of us are just send them to boarding school?
Oh my gosh. Okay. I think teenagers are absolutely fantastic. And I do agree with you that they get a bad rap. I think they're misunderstood, and I think that it gets propagated, in parenting groups and in media. But I think that adolescents are wired to do exactly what they're going to do, and that is to develop, to take risks, to grow, to stretch, literally their minds, their bodies, their hearts. I love how straightforward they are. I love how they can think outside of the box. I love their humor. I think I have a really healthy sense of nostalgia for my own adolescence. I love everything teeny bopper when it comes to media. I never grew out of that phase, but I think it's because that age range is just it's a really special time and it really resonates with me. And there are other people who see teenagers in this positive light, and I encourage everybody to just think about that narrative, that bad rap narrative of them being moody and difficult. And instead, think of them doing exactly what they're supposed to do. They're supposed to push. They're supposed to call you out. They're supposed to learn to say no. And so in a sense, these things that are really uncomfortable for some people around teenagers, that's exactly the beauty of where they are in life.
Yeah. So you kind of have to change your expectations of the human that you're talking to, because there's like they're a little adult, right? Many of them are fully grown at that age. And you might expect them to interact like an adult, but you're saying you kind of have to bring a little bit of empathy into your interactions with them because their brain is still changing.
Yeah, their brain is still, it's growing and stretching and doing exactly what it's supposed to do. And what's important is that a really important part of working with youth today and supporting youth today is what we call positive youth development, or a strengths-based approach. But positive youth development, the more positive rewards their brains can get, the more those get wired. So it's just so important to lift them up and to feed those like positive feedback loops, and to, if you got that negativity in your mindset, because, whatever, it's life, it's frustrating sometimes. It's hard to be a parent of a teen. I've heard from so many parents, but check it, just check it and try to, as exactly as you said, try to approach it with empathy, with wonder, with curiosity, with sort of think back to how you would have liked to be talked to when you were a teenager.
So I always say I'm so glad social media didn't exist when I was young, because then we would have this like online record of my terrible hair colors and clothing choices. What is it like for these teens that have had social media since they were born? It's been part of their life, that they've been documented by others. They've documented their own life. They're watching their peers digitally. Can you give us a little bit of idea about how social media has kind of changed the teen experience?
100%. Social media is undoubtedly a large player and a large difference in how we grew up compared to how teens are growing up today. It's not all bad. It is this great way to connect, to see people who look similar to you or have similar thoughts to you that you may not have in your real world. So it has, it's a way to get information that might take you to new places and expand your mind, expand your horizons. You might be able to make friends that are not friendships and friends that are not available to you in your immediate real life circles. And those can be really positive things. So it's not all bad, but yes, I think that in some teens who use it very, very heavily, especially in our young teenage girls that are going through a time of their life where their bodies are changing and they're self-critical about their bodies. And that's normal. That's you get very sensitive about your body because your body's changing. And then you add social media into the mix, and you add those awful filters that change the way you look, and you get inundated with this, with diet talk and with biases. And so it's very, very, it can be very, very disruptive to some teens. And I think we have to figure out the right balance. I think people talk about screen time, and I don't really think that that's helpful. I think from the moment that you wake up in the morning to the moment that you go to bed, screens are all around us. And I think it's helpful for us to talk about screen-free time and just sort of elevate those times when you actually aren't around even a screen, let alone just looking at a screen. And, I think the last thing I'll say is social media, unfortunately, is sort of here to stay. And screen time, screens are here to stay. So we need to help teens develop skills to use social media, use media, and not let media use them. And so really like empowering them to develop the skills to do that, and like feeding into that.
I love that. That's a good way to think about it. That it's kind of like alcohol. I don't know if you're going to agree with this one, but it's kind of like alcohol, and how teenagers who grow up in Europe, who maybe have a glass of wine with their parents when they're 16, 17 years old, they go to college and it's not a big deal. But for kids who it's been banned for, might then drink more. Is there any truth to that? Or is that just how we like to think about?
I will push back with you on that, because alcohol is in fact not optimal for a developing brain, for a young teenage brain. Just like nicotine and cigarette smoking is not optimal. Like in our best case scenario, we would avoid it. But social media isn't 100% avoidable, and it's not addictive in the same way. And so So yeah, I think of it as slightly different than what we would typically think of as like a substance or an addiction situation. I will say a similarity is, yes, you can get addicted to social media. You can have what we call problematic use, and there's help for that. So if that, if anyone's listening and you're concerned, there's help for that, of course.
So one thing I remember being so hard for me as a teenager was waking up extremely early to get to school by, I think it was like 7:15 in the morning. So we know that sleep is really important for children of all ages. It's important for all of us. Tell us why like schools start so early, and is there a movement to push it back? And would that be healthier for kids if they were able to sleep in a little bit later?
100%. Sleep is so important for adolescents. They need their at least 9 to 12 hours. And something happens when you are going through puberty in that your sleep cycle shifts a little bit later. So instead of going to sleep at like 9, they get sleepy closer to 11. And that's just normal development for a teenager. But that also means that their biological clocks, their circadian rhythms don't quite wake them up at the times, in the 6 to 7 a.m. hour that we are waking them up. And so they're waking up against their physiology and having to get to school and then having to be in a classroom doing math and science and other things like first thing in the morning. So yeah, this is actually a huge problem. And there is more awareness now. I think like all of adolescents, all of the issues that, that could be health and wellness issues in adolescence is getting more attention right now, thankfully. And so much of kind of supporting adolescents is looking at the systems that they live in and then advocating for the systems to work for them, not against them. Yeah. And unfortunately, I would say that these early or, usual normal school start times that are before 8 a.m., they are in direct conflict with their bodies. And so, yeah, there is a big push to change to later school start times so that teens can be, we know studies have shown us that this is a good idea, that teens will get more sleep. And when you sort of help with their sleep deprivation, because teens actually are chronically sleep deprived, they do better in school. They have less car accidents. They have less stress and mental health issues. They even have less physical complaints. And so sleep is so very important, as is, looking at other places in our lives where we have to really advocate for our teens.
Yeah. What other systems problems are there that you advocate for?
Oh my gosh. What are the things that are most harmful to adolescents and young adults right now? I would say gun violence, and I would say drug use, opioid use, this rising rash of this rapid rate of increase in deaths from fentanyl is just shocking. And so the systems why, and nicotine and cigarette and vaping. It's funny. So pediatrics is very much prevention. And when you work, and we know that as pediatricians, and adolescent medicine or working with adolescents is very much advocacy. And it's hard because people always try to say, oh, you're a doctor, stay in your lane. It's pediatrics, not politics. And it's like, well, actually, when you're taking care of an adolescent, looking at the systems that they live in and looking at sort of the disparities and everything that I mentioned, you look at the disparities in our youth of color and our youth who identify as LGBTQ, it's shocking. So the systems do matter. And if we aren't addressing the systems to take care of our teens, then we're falling short.
I love that. We've had a couple of episodes that have touched upon some of these topics. We had an episode on fentanyl with a mother who lost her son to a accidental fentanyl ingestion. We've talked about gun violence in schools. I feel like a lot of the major pressing issues just so happen to impact young people, disproportionately impact young people.
That is accurate. And that is why we need to step up and support young people, and they need more resources. And it takes a bigger public health effort to do that.
Yeah. Well, they're easier to write off.
Yeah, and that's so, that cuts me so deep because
they're not as cute as babies though, okay? They're not as cute.
Okay, fine, maybe, but I am drawn to that funny adolescent that's sitting across the hall that will show me something really cool on TikTok that will make me laugh. But they're a very special group.
We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
So you practice something that you call adolescent medicine. Can you tell us what this is and how it's different from general pediatrics?
Yeah, so adolescent medicine is a subspecialty within pediatrics. So people can be a pediatric GI or a pediatric cardiologist, or you can choose to do 3 more years of training and be an adolescent medicine specialist like me. And I love that you're asking me because no one has heard about our little field. We're a young field we're a very young field, and there are only a couple hundred practicing adolescent medicine docs in the country.
Wow.
And it's a really cool specialty because people come to us from pediatrics, but also from internal medicine and family medicine. And so it's sort of just finding this intersection of people who are interested in this age-based group of care. I think what helps some people to understand, what I do is it's similar to geriatrics. So it's sort of like I am a one-stop shop to take care of this age group. So if you find an adolescent medicine doctor to take care of your child, we will take care of everything from their puberty, their physical development, to their mental health, to sports medicine, to dermatology, to, all the various things that might impact their kind of growth and development.
Interesting. And so this is somewhere between then pediatrics. It's inclusive of pediatrics, but maybe also pulling in from just general medicine. So you're kind of like you have the clinicians that are both upstream and downstream for this group.
Yes. And what's interesting about what you just said is a huge part about adolescence is transitioning from childhood to adulthood. And people often think of like babies, they think of children, and then they go to adults. And it's like, well, no, there's this whole age range in the middle. And walking them through the steps of having their parents be the CEO of their worlds and their health lives, to having the parents step back and change into a consulting role and having the young person take over and own their own rights to healthcare and their bodies. It's really quite a transition and quite a handoff. Yeah. And so I love that space in between of being their pediatrician and then, eventually when they're, somewhere closer to 20, handing them off to their next provider, whether that's a family medicine doc or an adult doc. But we call it transitioning, and it actually starts early, where you start to talk to a young person, even as young as 11. Hey, by the way, I won't be your pediatrician forever. Unfortunately, we're going to get you to a point where you're in charge of yourself, and we're going to teach you the skills along the way to get you there.
I love that. So you said it was a newer specialty. How long has it been around?
Oh, like 10, between 10 and 20 years. Yeah. So I actually had the privilege of being a fellowship director for adolescent medicine, which means I was in charge of training future adolescent medicine docs for the last 8 years at the Children's Hospital of Montefiore. And I really loved that role because I live and breathe adolescent medicine, but be able to inspire others to go into the field and to help train them, it was a very special part of my role.
Yeah. And there are only a few hundred of you now. Is that growing as a specialty?
It is. Maybe 20, 30 of us are added every year. But then you may have people who retire as well. So yes, there's not enough of us. I mean, we are maybe 0.01% of all pediatricians in America are adolescent medicine experts or specialists. Wow. Yeah. So we're tiny. And if you think about it, it's just the needs of this age group are going through a renaissance. People finally are understanding that investing in adolescence is going to lead to investing in adult health, because you're going to be able to prevent cigarette smoking at a young age, that is huge impacts for an adult. And then it also ends up becoming generational. Like you can impact generations by helping behavior change in this special age group. Yeah. So, yeah.
So when you see a teen patient, you sometimes ask the parents to leave the room. I'm curious what the parents' response is to that, because that never happens in pediatrics, or at least it hasn't happened in my experience. So how do the parents respond to that? And then what kind of happens in that one-on-one time where something is happening that you don't want the parent in the room for?
Yeah, so this is the spice of adolescent medicine. So one of the cornerstones of what we do, or what we empower young people, is to have private time with their doctor. And so we ask the parent to step outside the room. But what's important before this happens is that we explain to the teen and the parent that, we're a triangle here: your parents, your doctor, and you. And we're all here to support each other and support you through your health and wellness journey. And what's very important is the parent-teen communication. I do a lot of work in the space of parent-teen communication, and it is just so important to help them communicate. And it's important to their health, actually. Like, they will have better health outcomes if they can talk to each other about health. And so what happens is I assure the parents that I'm also going to be, as much as I'm going to be spending that one-on-one time asking questions, I'm also going to be encouraging them to share everything we talk about with their parent. And then also there are limits to confidentiality. So confidentiality is a right afforded to minors. So minors are, under 18. Under 18-year-olds have some protections under the law. And it's really cool because it varies state by state in terms of what you can talk to your doctor about. If you are under 18, that remains confidential between you and your doctor, and your doctor cannot tell your parent by law. Yeah. And then if you're 18 and older, actually HIPAA applies. So you actually you have actually protected health information. And so many parents literally fall over laughing when I ask an 18-year-old, would you like your parents to stay in the room for this visit? Or would you like me to, because they often get a chuckle out of it, because their kid, they still feel very much in charge of their child. But at 18, I actually have to ask the permission of the young person of who they want me to share their health information with. Yeah. So that's always kind of a funny thing. But yeah, so minors do have some rights to confidentiality. And the reason why confidentiality protections are important is that teens who we explain this confidentiality to and who get that private time with us share more about their risk behaviors with us. And they return to care more. And so it's an evidence-based, all the professional societies support it, of a way of delivering best adolescent care.
And you tell them, I'm not going to share this with your parents. You reassure them in that conversation.
You reassure them in that conversation, and you also share the limits of confidentiality. So it is not, like carte blanche. So if there is a concern for self-harm or for suicidality, then those are limits. Or if we're concerned that there is abuse happening, then you're a mandatory reporter. So there are limits to confidentiality. And you do explain that to the parent and the teen before this is all happening, so that they are aware of those limits. And people often ask me, like, oh my God, what happens? Do parents get really upset? Do they say no? I have so rarely, after explaining why we do this, it's been once in a year, if that somebody has a hard time with it.
Yeah. You're in New York City. I
am in New York City.
Your peers in other areas might have parents that are perhaps more controlling of their children and maybe wouldn't react so kindly to being asked to leave the room.
Yes, that is 100% true. And also the laws don't support all of the different topics that you can discuss and keep confidential. Yeah. So there's a variety. And yes, you can go to the Guttmacher Institute. You can go to their website, and they have a beautiful chart that will show you state by state some of the items that you are able to talk to, including, so it varies in terms of reproductive health, in terms of mental health, in terms of substance abuse, what you can and cannot talk to. But yes, you're right that there are, of course, some parents in certain places that would have a harder time with this. And, for that, baby steps. We just develop trust, and we try, if not that time, we'll try again the next time. But I think my experience, when you share the rationale of why it's important, folks usually do understand.
Yeah. Okay. So talk to me about the teens whose parents are conservative or religious, who come to you or their provider wanting birth control, wanting an STI test. how does that work? And is there, obviously it's state by state, so maybe we just talk about it in New York. How can we help those teens while making sure that their relationship with their parents, remains intact?
Okay, so now you're getting really spicy. So
Yes.
in New York, teens have a protected legal right to birth control. So we'll just take the example of birth control.
Yeah.
And so if they come seeking birth control, it is my obligation and their right for me to be able to prescribe birth control to them and to review all the options and, of course, give them an informed picture and help pick what option that they would most prefer to use.
Without their parents knowing?
Without their parents knowing.
Okay.
And it's a state-protected legal right. And it is also something that so just because we say that, right, there are the systems may not always protect their confidentiality. And so what I mean by that is, like, if they bill the insurance and their explanation of benefits goes to the parent and the parents open the letter and it has a line item there for, birth control pills, then your confidentiality is busted.
Yeah.
And if your office sends a letter home asking, oh, want to do a checkup on you because you just started hormone pills, or if they call home and they don't kind of confirm who they're speaking to on the phone, they didn't maybe take the teen's confidential phone number down and list it in a specific part of the chart. So there are pitfalls to confidentiality that we in adolescent medicine have sort of learned through and have figured out how to stay ahead of. But we are often teaching our pediatric colleagues and folks who work in hospital settings to really take care of the medical record, of the electronic medical record, the portal, who has access to the portal. So we really like teens to have their own portal so that they have a place to get information that their parents aren't accessing. And so these are some of the pitfalls and some of the kind of workarounds or things that we have to keep in mind when we're trying to provide this, healthcare right.
Yeah. So what happens if, now I'm getting really specific, but I'm curious if a 15, 16-year-old young teen came to you saying, my parents would be so upset if they knew I was sexually active and I can't take the pill because they could find it in my room. Will you give me an IUD?
Yeah. So IUDs are considered a form of birth control. It's the intrauterine device. There are a couple different options within that category, and it falls under the realm of reproductive health care and birth control. And so you can still place an IUD or start that birth control method in an adolescent without having to disclose it to their parents in the state of New York.
Okay, great. I'm sure that for a lot of teens, that's a better option than the pill.
Yeah, it is an option that many teens really do enjoy, and it is an option that we used to sort of lead with it. Like, we used to say, listen, it's a long-acting reversible contraceptive, so it's kind of a one and done thing. You don't have to keep getting prescriptions, and you worry less about missing pills and this and that. And so honestly, for years, we used to lead with it and just say, it's our number one. And I think we've dialed it down a little bit, because the better way to have a conversation with a teen about birth control, instead of saying it's our number one, is tell me your story. Tell me your birth control story. Like, what have you thought? What have you tried? When would you like to start a family? To really come at it as from a place of being curious about their reproductive goals and what their fertility goals might be for the future, and to then develop a wholesome plan, because they may have every right to prefer, a different method than the IUD. But I will say that many teens love it. They absolutely love it.
Yeah, there's more discretion there. I hadn't really thought about that from that point of view. So another specific situation, I'm curious how it works for teen health, is gender affirming care. And we'll speak to New York, since every state is different. But if there is a teen who disagrees with their parents on the topic, how would you handle that?
Yeah, so gender affirming care is another and care of LGBTQ identifying adolescents is a central part of adolescent medicine. And I think it's a very special part of what we do because it's the approach, it's the care, it's the counseling, and because they carry a heavier burden of a lot of risk outcomes, and both in physical health, reproductive health, and mental health. So all of that being said, it's so very important to provide gender affirming care and sensitive care to this population. And luckily in New York, we are able to do so. Now, to provide that care and that approach, there's different levels of that care. So there's, if they want to be screened for STDs, we can do that. If they want counseling, we can do that. So if it's a younger adolescent and you're not going to necessarily start hormones, which is, I think, a question that I get more specifically from parents, like, would they start hormones on my teen without me knowing? In practice, this doesn't happen. It's a beautiful conversation with the family. The younger the teen, the more heavily the family is involved, typically. And so it is a conversation. And once you are prescribing medications, it does become a little bit more inclusive of parents than otherwise.
I think we could do a whole episode on this topic.
Oh, I would love to. It's just so important because quite frankly, their human rights are not supported, as we are seeing as legislation comes around in the U.S., and they're at risk of suicide, and they unfortunately are dying, and it's really a human rights issue, and it really is an important area for advocacy for all of us, but especially those in my field.
So, what needs to change in healthcare for teens and adolescents?
Oh my gosh, I wish every teen had access to an adolescent medicine specialist. That is my dream. That is why I speak out in media. And so some of that might be training up people and to be speaking to these issues and elevating these issues. I truly believe adolescent health is in a renaissance area where people are finally paying attention, for better or worse, probably because we are reacting to a mental health wave and to rights being kind of pushed back on for this age group. So I think it may be reactive, but whatever it is, it's a renaissance. People are paying attention. People are waking up to how important taking care of adolescents are. So my dream and my hope is to really increase the impact of my field. And so that might be more of us. That might be us sharing out more of what we do because my field is so young. A lot of people are still academics tied to children's hospital settings, which is wonderful. And my colleagues do wonderful, amazing work. But unfortunately, sometimes that work doesn't get heard outside our academic silos. And so I encourage, and I have a cadre of colleagues in adolescent medicine, and we're out there, and we want people to hear about our colleagues. We want to amplify their work, and we want to increase the impact and access to adolescent medicine. And in fact, I am co-founding a company right now called Thread Health, and that it aims to be the first digital health company that will put healthcare in the hands of teens and parents who support them.
Amazing. When are you guys launching?
We are seeing our first patients in the next few weeks in New York. So I'm really excited about that.
Yeah, I can't wait to see this roll out. I think it's going to be game-changing for so many families. Hina, we really appreciate all that you do for teens. I now have a better appreciation for what I generally think of as just like a moody a moody little person. And I just really appreciate all the advocacy and sympathy and work that you do. So thank you so much. And thanks for being here.
Oh, thank you so much for taking the time to hear me out and to share out about adolescent medicine. I really appreciate it.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our intern is Antonella Sterniolo. Our host is Hallie Tecco. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.